Zirconia, zirconia, zirconia. Everyone's talking about zirconia. But what about zirconia? What's the truth behind zirconia? Because when you find that they only want to put zirconia, how can they be so sure? And this is an information that is very delicate because I'm talking as an implantologist. And I can tell you that you cannot sell to a patient zirconia without seeing a CT scan, without seeing a clinical examination, and without even drilling the bone. Because once you drill the bone, you can have in our machinery, we can reach 50 newtons. If you reach 50 newtons, then you're a candidate for zirconia. Depends on the occlusion, depends on the type of bone. But how can they promote or sell zirconia without even doing the drilling? Because zirconia sells, the name zirconia sells a lot, and you think that it's the best, but they haven't told you what's the bad things about zirconia. It's heavy, it's gonna be a one piece. If it breaks, you need to rechange everything. That obviously is gonna cost the patient. And what about else the zirconia? At the end, it's giving the same strength that you have. Let's say that you hit here 100 pounds, that's going to be the same 100 pounds that are going to go directly to the implants. And what if you have a bone type 3 or type 4 and you're going to be receiving those masticatory forces? Because remember, you're going to be eating and chewing and grinding the same way that you destroy your own teeth. At the end is protect the implants. Protect the implants is the most important thing. And there has been lots of research where they say that zirconia is good, but at the end, that strength that is going to be receiving is going to be going directly to the implants. So why hybrids or why nanoceramics or things like that? It's because you want to reduce those vibrations of bite to the implants. So we want to protect the implants. Remember, those are the foundations. If you lose an implant, everything's going to go apart. Yeah, but they are zirconia. That doesn't matter. They even talk about having zirconia for everything. That's not true, and I can certainly tell you I've been placing implants for more than 20 years, and implants are not for everyone. That's the first thing. Implants, you will search 4 types of bone on all types of patients. In different areas, you will have all that part. And how do they know that they can do zirconia? Until they drill and they can tell you, hey, we did 50 newtons in all the bone. You're a perfect candidate for zirconia. And also, what was the story about that patient? Because if you have a grinder which rides a truck and you want zirconia, zirconia is not gonna break, probably. Well, what's gonna be happening? That those implants are gonna be under so much stress that probably you're gonna have an implant, the body's gonna say, I don't want it. And then you have problems again. No more implant, no more zirconia, and you need to start again. I have lots of patients of mine which they have hybrids rather than zirconia, and you reduce that impact from the biting and chewing and grinding up to 70%. And that works really good. It's not that you don't want to do zirconia, but it's like selling a Ferrari and you live in a town. Okay, it works? Yes, but you'd rather go for a sub rather than a Ferrari. Both are good. Depends on the cases. The only thing that I tell my patients is see yourself in the mirror, see your x-ray. That same amount of pressure is what you're going to put on your new materials. That doesn't mean that zirconia is not going to receive that stress, but the implants are going to receive that stress also. Zirconia sells. And when you talk about zirconia, the price is here. But the difference between hybrids and zirconia is going to be a big difference. This is not something that you buy. This is health. And we're talking about health. And I'm in love with what I do. So I tell my patients, what I can assure you is can I do hybrids? And in your case, where you have severe periodontal disease, where you have destroyed your teeth, but you still have some bone, for sure I can do hybrids. Hey, can we do an upgrade to zirconia? Of course you can. But let me first put the implants. But what if I do my drilling and my implants, rather than going for 50 newtons, they are in 25, 20, 30 newtons, and you want to put zirconia, and you're a grinder, big, tall, 6'2", what's going to happen? That's going to be something that sooner or later is not going to be a long-lasting term solution. That's what worries me more. So do your homework and search for doctors that they are ethical, that they can tell you that, and they can assure you that they can do zirconia once they place the implants, not before. Because if they tell you that before even giving you a consultation, you need to start to worry. That's an ethical way of placing implants. Place them in, and then you can talk. Obviously, you're going to restore them once you have the implants. But what material? I think it's a doctor's decision once you have reached the newtons, once you have seen the anchorage, and have you seen the type of bone that the patient has. That's the only way that you can know if they are candidates for zirconia. To all my patients, sorry that I don't tell you, everyone, hey, I can do zirconia, 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 but I'm in love with what I do and I have lots of respect and I have lots of honor to what I've been doing for all my life. And I want my patients to have the implants the same way that I would like them to be talking to me. So this is me. Bye.